baby daughter Melissa died at the Bristol Royal Infirmary following heart complications. "I just assumed that she was in the best hands," said Mrs. Clark. Now, 9 years on, and with a tragic legacy of children's deaths at the hospital, the inquiry will be the largest investigation into practices in the National Health Service for many years. But is the inquiry itself properly established to get to the truth? Not everyone thinks so, as Richard Liddon reports.
Around 500 families have waited 10 years to find out what went wrong at Bristol Royal Infirmary. But even as the inquiry panel took their seats today, Channel 4 News can reveal a behind-the-scenes row about the lack of a surgeon representative. Last September, Dr. Nick Barnes, a leading paediatrician at the world-renowned Addenbrooke's Hospital in Cambridge, claims he was offered the job of being the only doctor on the inquiry team. He wrote it in his diary.
"I am formally offered and accept the job. Greeted with enthusiasm, welcome to the panel, and asked to attend the first meeting on 22nd September.
At subsequent meetings with Professor Ian Kennedy, the inquiry chairman, and Una O'Brien, the panel's secretary, Barnes argued for a surgeon to be included.
To achieve real credibility in these findings, both for the parents and for the medical profession, and these can be really important recommendations on how surgery is organised, how surgeons are judged, how surgeons are supervised, how they're trained. Surely, if one is going to come up with those sort of recommendations, you've got to have a surgeon on the panel.
But a couple of weeks later, Una O'Brien came to tell him he was no longer needed.
We decided earlier on to advise the Secretary of State that it would be an error to appoint someone with one narrow area of expertise. Better to select someone who was a generalist and then back that general experience with a panel of experts.
The place Dr. Barnes thought was his has been taken by Professor Sir Brian Jarman, a GP academic who advises the government. As they left the GMC hearing last June, surgeons James Wishart, his colleague Janardhan Dasmana, and the former hospital chief executive John Roylance knew the matter wasn't over. The GMC had only looked at 53 operations in which 29 babies died and 4 were left brain damaged. The public inquiry has a much wider remit, checking 2,000 operation records and the deaths of at least another 200 children. Samantha Rickard was one child who died. Her grief-stricken father, Andy, killed himself. Samantha's mother wants other doctors, nurses and managers called to account.
They're all part of a team. None of them can work individually. And then there's the Royal College of Surgeons. It just goes so much wider. Local, you know, health authorities in different areas, in different catchment areas. I just think it's long overdue that these people came and gave their account of what was going on.
The inquiry will take 2 years and cost up to £15 million. Any recommendations made will apply to the health service nationwide. Richard Liddon, Channel 4 News, Bristol.
Some of the rest of the day's news now from Tanya.
Thanks, John. Well, continue.